Welcome to section 50 of bacteria. This is the figure showing all the bacteria you need to know for step 1. In this section, we'll be discussing Mycoplasma pneumonia. Our story takes place outside a college dorm, which you can see to the left. Aliens are invading the area of these poor, unsuspecting college students. We can see the spaceship of the alien craft right here to the right. Out walks a blobby plasma-looking alien. This plasma alien represents Mycoplasma pneumoniae. This is a bacterial infection that can cause pneumonia. So when you think of this plasma alien, think of mycoplasma. Being a plasma alien, this monster doesn't have a hard exterior at all. It's just a blobby mass. This represents the fact that Mycoplasma pneumoniae does not have a cell wall. This means that it doesn't gram stain well. Hence, we haven't included pink or purple to this image, like we have with most bacteria so far. So this plasma alien without a hard exterior will help you remember that Mycoplasma does not have a cell wall. As the spaceship landed, it put out a lot of smoke. You can see the nearby college boys get engulfed in the airborne particles, causing them to cough uncontrollably. This coughing represents pneumonia. Again, this is pneumonia caused by the plasma alien, or rather, the Mycoplasma alien. As you can see, some of the plasma aliens have already started causing mayhem. This alien has eaten some poor college student. The fact that the alien has eaten this guy will help you remember that Mycoplasma pneumoniae is cultured on eaten agar. So, eaten student for eaten agar. Now this infection is most common in areas where young people are densely gathered, like a dorm for example. Most college dorms are filled with people under the age of 30, and they are fairly densely gathered. This is the perfect setting for a plasma alien invasion, or a mycoplasma infection. To combat the aliens, the military was called to the scene. You can see them here, ready to fight and take down these monsters. These soldiers represent yet another population prone to mycoplasma outbreaks. Military recruits are susceptible to these infections just like the dorm students are. For that matter, prisons are full of densely gathered prisoners, so you should think of those as well. So when you think of the military fighting off the plasma aliens outside the dorm, remember mycoplasma infections are more common in dorms and the military. Now these soldiers are trying to take down the aliens any way that they can think of. They started the fight by firing arrows at the aliens. You can see the impaled alien dripping its alien blood. It's coagulating on the ground and collecting those pretty looking snowflakes. Those snowflakes look like IgM antibodies. IgM antibodies form these pentamer structures, so 5 of them together. This gives them that pretty snowflake appearance. For this reason, we like to use snowflakes to represent IgM antibodies. Now, mycoplasma infections bind to eye antigens in the lungs, which resemble antigens on red blood cells. So when the immune system forms antibodies against mycoplasma, these same antibodies can also cross-react and attack host blood cells, specifically the red blood cells. This leads to hemolysis due to IgM antibodies. So, tying this all together, the bleeding and coagulation attract snowflakes. This stands for IgM antibodies causing bleeding and coagulation in mycoplasma patients. And this coagulation or agglutination happens in particular at cold temperatures. Notice all the snow making everything appear super cold? This is the prime temperature for IgM antibodies to agglutinate and lyse the patient's RBCs. Now these military personnel were unsure how exactly to kill these plasma aliens, so they brought an experimental X-ray machine. You can see they successfully trapped this monster who is now in agony. The beams of radiation are causing these little nodules to form in the alien's body. These nodules, caused by the X-beams, represent the nodular appearance of X-rays in patients with Mycoplasma pneumonia. So again, nodules with X-beams stands for nodules on chest X-ray. Now, Mycoplasma pneumoniae is a form of atypical pneumonia, or walking pneumonia. Patients have pneumonia, obviously, but it can last a long time, which is one of the reasons it's atypical. In any case, patients often complain of headaches during their lingering infection. This monster is wincing in agony from the X-beams. It's giving him a super bad headache. So again, monster wincing in agony stands for headaches with mycoplasma infections. Now some of the dorm girls are trying to fight off this alien, and they're doing an excellent job. The first girl threw some pennies at the alien. It's all she could gather and all she could think to throw. Now these pennies went right through the alien. Remember that Mycoplasma pneumoniae doesn't have a cell wall. This means that beta-lactams, including penicillins, will be ineffective. So again, pennies going right through the alien will help you remember that penicillins are ineffective against mycoplasma. Now the other girl jumped on the back of this alien and can now be seen choking it out with this stick, the stick with flowers on it. She is actually causing the alien to bleed. So this looks like an effective attack. So why is the stick working against the alien and the pennies wouldn't? Well, you see, the stick with flowers on it represents fluoroquinolones. Fluoroquinolones do not attack the cell wall to kill the bacteria. Instead, they mess with the DNA. This makes fluoroquinolones an effective treatment against mycoplasma. So again, flower staff stands for fluoroquinolones to treat mycoplasma. Over here to the left, we can see a guy picking up his girlfriend on a dirt bike. They're going to get out of this dangerous area. What better way to make a getaway than on a dirt bike? This dirt bike stands for doxycycline, which is part of the class of tetracyclines. This drug is also effective against mycoplasma infections because it doesn't kill by attacking the cell wall. It works by interfering with protein synthesis. So again, crushing the alien with a dirt bike stands for treating mycoplasma with doxycycline. On their way out, they are crossing the path of this scarecrow right here next to the dorm. The word crow, as in scarecrow, is also in the word macrolide. So we like to use scarecrows to represent macrolides, as we have demonstrated with previous images. Similar to doxycycline, macrolides work by inhibiting protein synthesis. This means that macrolides don't need the bacteria to have a cell wall in order to destroy it. So again, these escapees passing the scarecrow on their way to safety represents macrolides to be used to treat Mycoplasma pneumoniae.